Back in the game. Good evening, good afternoon, hello, wherever you are. But wherever you are, you're probably watching this from at home because yay, quarantine. So let's do this. I always want to do roll call, quick introductions, and we'll start with the General Taylor, Taylor Made Dream, Russell Taylor, who has been there, done that. Let's do this. Tell them who you are.
Good evening, and thank you, man, for allowing me to share your platform. My name is Russell Taylor. I have a YouTube channel called Taylor Made Dreams, and basically the channel is about giving out information, trying to empower brothers and sisters to not only travel overseas but to live overseas, to enjoy their life, I think, more abundantly overseas, and just the freedom that you can have and experience. So I tell people how to set up bank accounts, go through how to do a residency, share with them, how I brought my car, just anything that has to do with living overseas. I'm in DR at the moment. That's where I'm living. I'll be here for about another 2 years, and then I'll be out of here and somewhere else. I've been looking into Africa quite a bit since we've been in this pandemic mode, man. For some reason, I hear the drums of my ancestors calling me, so who knows?
And for the record, when he said DR, he means the Dominican Republic.
Yes, thank you.
Because not everybody, is up on you cool guys lingo. But yeah, that's his channel, and I say it all the time. There's enough room on YouTube for everybody to be friends. Definitely go check out his channel. As a matter of fact, I'm going to put a link to it in the comment section. And I'm also going to show you guys here where he and I had a great discussion. Let's see.
Always have a great discussion with you.
We did tailor-made success. And we went past just the expat phase. We talked into a lot of his history, what made him who he is, what got him where he is.
Mm-hmm. Very true.
And Mo is a regular. Mo is, Mo's family. Right now, it looks like, what do you got, a pencil in your ear?
I'm actually remodeling a house right now. I'm flipping it.
Well, I brought Mo in because he has a uniquely qualified reason to talk about this whole Corona thing. Kind of tell him how many letters you have after your name.
I only have 5. Only 5. My name is...
Tell them what they are. It's kind of important, though.
Everyone's important, right? I'm a Bachelor of Science in Nursing, Bachelor of Science in Psychology, and I'm working towards my doctorate of nurse practitioner. I have experience in rural nursing, and I do travel nursing. So similar to you guys, instead of traveling as much international, I work in rural healthcare places, and just kind of an orphan or a nomad. And so I have a good amount of experience in a bunch of different healthcare systems. And definitely seeing the rollout of this very interesting coronavirus and how it changed what I do, and generally just how hard it is without national coordination. So those are my qualifications.
Well, you know what? One day you and I are going to have a story just about some of the air quotes interesting things that you get to see during rural America, because you're out there in the heartland of America. Bringing healthcare, bringing just stuff to people that don't get services and help.
Yeah, so populations of maybe 2,000 to 1,000 in areas where there may only be one rural hospital, which are unfortunately were funded by Obamacare, which many people out there are not huge fans of. So the irony is always present.
Wow. Well, let's do this. Aya, this is your first time with the team. You have a wonderful smile.
Thanks.
You wanna give us a little give a little taste of who you are and how awesome you are. Maybe some of you don't have to give away any big secrets. Tell us a little bit why. Because here's the thing: if you're here with us, you're somebody extraordinary. I don't have any friends that aren't really, a lot of them hide it, but everybody that I hang out with got a little something special under the hood.
Okay, so I'm a psychologist, and my work focuses on discrimination and health, specifically around domestic violence. And yeah, there is a lot under the hood, and I'm excited to contribute to this conversation.
Before we get too far, please, can I get your contact information? My dissertation is on primary prevention, especially in minority communities. So I'm very curious to either read some of the stuff you on, or at least share resources so I can learn something.
Sure.
So quick hello to Renee. Quick hello to BMT. Thanks for stopping by. And for the record, I vouch for Mo. I can absolutely say without any question at all, he's someone you can contact with, and I absolutely put my reputation behind his name.
Thank you.
You said something that, I suppose if we're going to get into the grim parts of it, we're going to start with something. When I read this, I didn't know that it was real. I didn't know that it was an actual thing, so to speak. When you talk about domestic violence and you talk about it in minority communities, is that a reasonable statement? Minority communities?
Sure, marginalized communities. Yeah.
Well, let me back up just so we understand. Marginalized communities are what? Because I want to see how this is going to change what's normal inside a lot of communities. Because this is what I've seen, and I want you to tell us if I'm wrong. This is just a layman's discussion. I have seen a lot of people say that because so many people are now locked in and quarantined with people that, in the past were their abusers or could be their abusers, they can't get away now. And that a lot of the things that were not normal before, the abuse may not have been normal before, and it's becoming normalized. I mean, where am I going with this? Because I want to be wrong.
So I just want to make sure I understand your question. Are you trying to understand how domestic violence has changed in the time of COVID, how it's exacerbated?
That stuff.
Yeah, so when we think about domestic violence, we can understand it in terms of many different forms of abuse, right? So psychological, emotional, financial. And what tends to exacerbate violence is thinking about access to resources or lack thereof. And as we've noted with other health inequities and disparities that are highlighted with COVID, domestic violence is no different with regard to barriers to access. And we can think about that in a number of ways, right? So, for example, thinking about impact of shelters, right? Shelters were already overwhelmed and burdened before coronavirus. And now we see that that's the case currently, thinking about barriers with regard to the court system. Those still exist, if not exacerbated now. Thinking about lack of access to resources for victims and survivors. Same thing now, right? With regard to people not having access to money, resources, jobs, unemployment's through the roof. And so it's not just about being in close quarters with people, but more so about power inequities and how those are being exacerbated by the virus.
Fascinating. So you look at domestic violence almost in the same way that you would look at many other diseases from an epidemiological perspective.
Sure.
Oh, okay.
So wait. So domestic violence is how would I put it?
It's a public health issue.
What do you use the model of like primary, secondary, and tertiary prevention when you speak about domestic violence in a similar way, or is it not the same model?
We can talk about primary, secondary, and tertiary aspects of prevention. We can also think about intervention, but we would need to think about those from like a multi-level perspective. So not just from an individualistic focus, but also from a structural systems focus. And that's what my comments were talking about before when thinking about lack of access to resources, lack of support from systems or structural perspectives.
Fascinating. So what secondary and tertiary, I'm sorry, I'm hogging it all? I find your stuff so interesting. Like what secondary and tertiary like prevention methods do you use during like a crisis right now to kind of hopefully turn problems like this around?
Yeah, so I would actually I can open this up to talk to you all about when you think about primary, secondary, and tertiary care, when you think about other health disparities, kind of like what are we seeing as modes of intervention during a time of crisis? Like, what do we think are effective ways of mobilizing? I think that, on the ground, community level mobilizing, when, as you alluded earlier, federal and even state level approaches have failed us, what does that leave us with, right? These are some key questions that we can begin to ask ourselves.
Can I
violence and across the board with different health issues that impact our communities, right?
Okay, Brother Taylor.
Yeah, I'd like to ask a question. I just want to throw something in the mix, and especially since you are a psychologist. I'm not a psychologist. I mean, I have a couple of degrees in psychology, but I never went on to get any license or anything like that. But is there a case? And this is what I keep telling people, especially within the African American community. People say a lot of PTSD. I call it post-traumatic slave disorder. I think really that our people, especially in the Black community, are suffering from not only lack of miseducation, but the images that we see every day, the derogatory images that we see. Now Black people are buying into calling each other the N-word. It seems like the image of just getting out of jail is highlighted, and it just seems like it's almost like all the progress of the that came out of the struggle of the civil rights era has just all been set back, even though we got more money. And I know when the Jewish community went to the World Court, they said that the Holocaust, which only lasted 4 years, was such a traumatic, a horrific and traumatic horror on their community that it would take 6 generations to repair the damage. Now we're talking, 300-400 years of slavery, Dixiecrats and just everything that came after that. And I really think as a community, and one of the reasons we cannot get together and understand that in numbers is our strength is that we're suffering from post-traumatic slave disorder.
That's heavy. Gonway, how about this for timing? Say, hey, Gonway, by the way, magnificent beard you got going there. I love the color.
Hey, man, it's about to go as soon as the barbershop's open, man. So enjoy
Are you
the white
serious?
beard.
How dare you?
I'm about to get rid of this, man. I'm tired of that.
Really?
I am done. I prefer more like the Suave look. The Brazilian thin mustache with the goatee. That's been my look for forever. So if it ain't broke, don't fix it.
Conway, we're friends, right?
Huh?
We're friends, right?
Yeah, we're cool.
You were never that handsome. Go for the burly beard.
Hey, hey.
Don't go for why do you think I don't have some kind of a pretty boy mustache? Why do you think I grew this belligerent fuck you, thing? Because you gotta know what works, man.
This doesn't work though. So that's what I'm saying. If it ain't broke, don't fix it. You said what? You hope it does. Nah.
Conway was out here in Brazil and came out, hung out in Rio, went back to America. Now he can't get back here, and I'm wishing he was here hanging out with me. But I also want to, when we get through this quick introduction, tell them a little bit about who you are and the situation you're in, because I want to hear from you after we go back to Aya what she said in relation to Taylor.
So I mean, I'm officially 30, so I'm no longer a youngin. You know what I'm saying? I'm getting up there. But I like to think so. But studying programming, I travel a lot, so I'm between Rio and here, looking to go other places in a few years. So I mean, I'm in Minnesota right now. As far as the COVID thing, we have a shelter in place, but it's not really rigid per se. I mean, you still got people that hang out. Like they did relax some of the restrictions, so you see a lot of people on the streets now, parked. Supposed to open restaurants for drive-in and whatever. But I don't know. I'm just here. Just go to work, come home, and that's it. Pretty much. I ain't really doing nothing special. I am essential though, so I'll take those essential privileges where I can get them. But pretty much that's it, man. It's the same thing. Ain't nothing different out here.
So I'm going to paraphrase what Russell Taylor said a little earlier when he asked, how is the post-traumatic slave disorder affecting the norms that we're dealing with now? Because I have friends from all over the world that went back to the United States when the United States issued that giant thing on whether or not you want to. If you are abroad, if you come back now, you have a chance. But then if you don't, they said, you're not going to get a chance to come back. Well, I know a lot of people that went back to the United States, and I don't know a single one that is glad they did it.
I got the same thing.
They're going back to that same.
I think it's too. I think it's too general. Because it really is case by case. I mean, my situation, why I came back. I just didn't trust the Brazilian health system enough to kind of weather, to stay in Rio. During
okay,
this.
well, we got. If we're gonna, I would never have openly said that, but you got to clarify. You can't just get one side.
I'm a diabetic.
So make it seem like you came to Brazil and you don't have medicine.
Well, I'm a diabetic, so being that the Brazilian health system is not on par as to the United States, barring there is a huge cost differential, I figure my chances would be better here, which they are. I haven't gotten sick, but that's just because I've been doing my own health management, whatever, that completely different. But as far as money wise and the dollar being like it's stupid high right now, I kind of wish I would have stayed on that aspect. For everything else, I wish I would have stayed in Rio. But, as far as what could have happened, as far as health-wise, and I'm glad I came back. So I'm kind of split on it. I'm not saying that I'm glad, but I'm not saying that I regret coming back either way. So I don't know.
I think that America has really done an excellent job of selling an idea of exceptionalism and things that are simply American. When we really look at any study about epidemiology, longevity, America actually does a pretty poor job of managing a lot of conditions. To be fair, probably your chances for diabetes and receiving care, they may be good here if you have money, because healthcare in the United States is as good as what you can afford. But for instance, in places like Cuba, for instance, they actually have a far better record for actually small cell lung cancer and diabetes in people in the United States. Actually, there are multiple medical missions to Cuba just to see that their system works. And they do it for far less than we do. But say for anyone, sometimes the United States isn't always, it's familiar, but it's not always the best at doing this. My experience has really shown me that that to be true in so many ways.
That's true.
Another quick question, Conway. One quick question, just to make sure we're on the same page. Did you have one of these?
One of what? What is that?
The SUS card.
No, I didn't get one of those.
So now we're not going to have a Brazil night. I don't want to talk about Brazil because that's not the main subject. But let's be clear. You lived in Brazil long enough to have done the correct registration to get on the national healthcare system, which would have taken care of a lot of your problems, but you didn't. So you can't say Brazil didn't have the resources. You chose not to avail yourself of them. You can't blame Brazil because you didn't get the medicine you wanted. This is a national free registration for healthcare, and you chose not to get it.
Well, that's with a caveat, though, because, I have not to put all my business out there, but there's another, like, I didn't want to take the chance of them not having some of the stuff that I need. So that's another conversation. But you're right, I didn't. But to piggyback what my guy said is, yeah, I mean, that's true. The United States does have this exceptionalism, like we're the best at everything, when that's clearly not the case. Living in Rio, I would say it's a lot easier to manage things like if you have issues with, whether you're diabetic or you have issues with fluctuating weight or that, it's a lot easier, in my opinion, to manage that because, for one, the medication is ridiculously cheap in Rio. So there'll never be a time where, in Brazil in general, but my experience is in Rio, so I'll just reference Rio. But it's ridiculously cheap to get your medication in Rio. For one of my insulin pens, it's like $15 to get it. In the United States, a pack of 5 is about $900. So it's like, $900 or $15. Which is more cost effective and which can I rely on in a time for me to maintain my survival? And two is that, just due to the lifestyle in Brazil, it's a lot easier to, maintain your health. For example, I used to always eat fresh fruit. I always used to eat acai. Acai is good for diabetics because it's very low in sugar and it helps maintain your blood sugar. So I had a lot better health state. But, like I say, with all the things going on, I was like, well, I'm familiar with the United States, like Nice Mo said, and I was like, I might as well just come back. So, yeah, I mean, it's kind of a difficult situation.
So let me go to what we talk about normal. You tipped on something that I wanted to get on, and you're all in different cities, and I want to ask your opinions on these. You talked about eating well and eating correct. Anybody who knows me knows when I look in the mirror, I still see the fat kid that wet the bed. So I'm lifting weights all the time and I'm drinking water. Like, I'm never going back. So you always see me, what do I talk about, drinking a gallon of water a day? But it's difficult now because, for example, I don't have my Saturday market where I can go down, buy 5 pounds of fish for almost nothing, a giant bag of every possible fruit you can imagine, another giant bag of every vegetable you can imagine for $50 US. Now, more and more often, I find myself scouring the takeout menus on the internet. I'm ordering in, trying to order correctly. I don't know if there's any good delivery food that's not purely vegan or vegetarian. Is anybody else struggling to not make eating in their new normal?
Well, can I jump in? I'm gonna say, and I want to jump in first because honestly, I'm not having that issue in Dominican Republic at all. The supermarkets are full with fresh fruits, vegetables, fish. I'm actually eating more healthy because I'm cooking almost every day, and I'm cooking my own meals. So I'm shopping more on the outside of the aisles, where the fruits and vegetables are, and changing my my eating habit up. So I don't know how it is in Brazil, but I'm telling you, in Dominican Republic, and I still go out there during the non-curfew hours and still get my fresh coconut water with no issues. So and as far as medications, like there's medications that I need to take that I just basically stockpiled during the pandemic, and I mean, quite honestly, besides the curfew and the pandemic, I mean, life is fine over here.
Well, the markets are closed.
In Brazil?
In Brazil, you're not going to go to your outdoor market. A lot of people have seen the pictures I post of going to the outdoor market in Brazil. You're not going to have the outdoor markets anymore. No.
What about the supermarkets?
Supermarkets are open, but it takes a long time to go because what a lot of them are doing is they're saying, okay, the supermarket is this big, so we're only going to allow this many people in. And when they come out, one person can go in. And I was not a supermarket person anyway. Outside is where I would get my food. I'd go to the markets on Saturday. Thanks for the compliment, Dave. David Stretch, Green Machine. I haven't seen you in a little while. Glad to see you back. Hey, everybody, do everyone else a favor. The same thing that Naima Butler always says. Make sure you click the subscribe button here on the YouTube platform, because that's how I get to meet so many amazing people and talk and have so many great discussions. I'm experimenting with going on YouTube and Facebook. And for everybody on Facebook, make sure you click the link that I put under the video and come over and click subscribe on the YouTube as well. So, let's see.
To finish your question. Go ahead.
I was going to say, Uncle Ladrunia said the United States sets the standard in medicine for the world. Healthcare is generally more expensive, but that doesn't change that the United States sets the standard, which I agree with. And I believe everyone here knows I'm a capitalist in my heart. I believe everyone should make a profit. The problem is when you've lived abroad, and I've lived in, and when I say lived in, I don't just mean visited. I've lived in about 15 countries throughout my life. I can tell you there's still a tidy profit to be made without making the cost of medicine and healthcare so far that a middle-class working person can't afford the medicine they need. That's just ridiculous. Because doctors make a good living in every country I've ever been in, and they still do it while people like
how do you square that with what's happening right now, and where we're seeing that people who need care can't afford to get care, and in fact have to constantly expose themselves to the virus to survive, right? To meet basic needs that aren't being accounted for. How do you kind of square the capitalist view with those failings?
I would square it by saying they may still have to expose themselves under the, if this was the Wateef dictatorship, they may still have to go out to get the medicine they need, but the cost of the medicine they need wouldn't break their family. For people who don't know, I spent many years before I did the job that I do now. I have my own company. I do editing, proofreading. I coach people in public speaking for TED Talks. Right now, I do a lot of resume writing. I'll actually put my LinkedIn on the screen so that if anybody wants to join me there, they can. Here's the thing. I worked for nearly 10 years as a financial professional. I can tell you, I had too many people in my office that I thought was coming to talk to me about how to invest in a mutual fund or how to use cash value life insurance later in life as a non-taxable source of income for themselves and their family. Instead, I'm getting regular working class people who had the dumb luck of mom finding a lump in her breast, or dad falling at work, or a child born with something that's going to cause them to need medicine the rest of their life, and it bankrupts the family. These aren't people going out there buying things they don't need. These are people that have an everyday job, and it just bankrolls them.
Right. So that kind of system then is not sustainable, right?
No.
I think that it's also important to differentiate between the different types of capitalism. Like, it doesn't sound like you're talking about laissez-faire capitalism, which is a very different beast. And then we kind of it gets conflated too with capitalism as an economic system,
right? As
opposed to many look at it like as a political system.
Sure.
But I think the United States as a corporatocracy really is a poor representation of how capitalism could be more reasonable. I don't know if I agree with it all the time, but I think it could be a more reasonable system if something like a capitalist-based market with a more social democratic kind of government. The problem here is we have corporatocracies and oligarchies, an oligarchical system for how people are elected into government. So it takes money to get into the government, and it also takes money to make money. So you have this crazy situation that's a perpetuating circle, and that causes the problems that I mostly see.
I appreciate the distinction thinking about economic system and government systems, right? Because you refer to Cuba thinking about socialist kind of economic system, and then thinking about communist kind of government system, and thinking about what the benefits or limitations are of each of these approaches. But what we're seeing here in the United States is that there's just failings left and right. You can pick any aspect of this pandemic and think about it from this perspective in the US, and everything just crumbles.
Right. But we can look at a somewhat similar system prior.
I'm not pointing at just one area.
I hear you. I hear that you're not just looking at one area.
But I'd say that we look at H1N1, SARS, and MERS prior to this,
And we had them under different administrations with different social safety nets and a better incorporation of like the CDC, the International Surveillance Pandemic Group. And we can see that those like disasters were met very differently than this one. So we can't blame this all on capitalism necessarily, as much as we can blame it on like really ineffectual leadership to a point too. And so I think that that's like one of the defining factors that makes this especially awful.
I think it's the interaction between the two. I think yeah.
At its worst, it's horrible. It's dog eat dog.
It's a total failure in leadership. It was an absolute failure in leadership. It was absolute failure in recognizing the signs early. It's an absolute failure in just reading notes. You know,
this is where I disagree because I think about what Yusef just said prior, and when you're thinking about someone having a pre-existing condition, or the fact that if you have a medical issue and that could lead to bankruptcy, just one medical issue. Thinking about what Wade talked about before in terms of access to medication and the inflation of prices for medication that you need to survive, those to me sound like failings regardless of whatever administration you're looking at, right?
Well, we could have had something like the ACA in place, which was, while it did have its shortcomings, would have met this disaster with far more effectiveness than it would.
I hear you, but even before the ACA.
I'm a socialist person, so I like those ideas. I just don't think that capitalism is not necessarily incompatible with a better government system, but it does make uses of power more easy, which is what we're experiencing right now.
Okay, so then what is the resistance then to incorporating more socialist leanings within thinking about our privatized healthcare system?
Hypocrisies.
Sure, I hear that, but I'm saying what then do we collectively consider and think about in moving forward?
Are you asking me or asking?
I'm asking the panel.
Because my answer is eat the rich. But
I'm asking the panel collectively.
For the record, one of the things I always try to do is make sure for people who don't know all of our lingo and abbreviations, when they say ACA, this is what they mean. Medical definition for the Affordable Care Act. Some people call it Obamacare. Okay.
Yeah, but if you look at other countries' healthcare systems that has basically uniform healthcare systems like Canada, Switzerland, they have very functioning healthcare systems that work, that service their people. So the fact that having a medical system on the capitalist system, and seeing that the bureaucracies, the inadequacies, the unfairness, there's no way anybody could honestly say that this system works. It's broken.
It's broken on purpose. This is no accident. This is no accident at all.
Right, correct.
I just wanted to answer like Camille Richardson. I just saw the thing. I was just going to say a big part of leadership is how people treat problems. And you have an administration that refuses to wear masks.
Mo, your volume is a little weird.
Oh, can you hear me better now?
Yeah, I think so. Did anybody else get any kind of weird distortion?
Am I echoing?
Now you're better, a little bit better.
Okay. The problem is that when we have a government that doesn't have solid guidelines and a very uniform system, it sounds to people like you can do whatever you want. So many people will do that. And then we also have a large problem with, Mike Pence just went to make the clinic, not wearing a mask. People learn a lot by modeling behaviors. And when we have leadership that doesn't care about it or shows that there's a complete disregard for science, you can't expect the average person to respect those ideas either. The second part of that is people in Michigan and those kind of armed resistance groups are just a part of our the terrorist nature of what white supremacy is in the United States and has been for a long time. And it's allowed and normalized, partially by this administration, but also just in the history of the United States. And that's, those things just rear their ugly head.
Now, hold on a second. Let me back up. Two things. One, Mo, for some reason, you'll hit a position and I hear you perfectly, and then something will shift and it sounds like you're underwater space alien. And for the other people, I want to show everybody this is what we're talking about. This is what Camille is talking about. In Michigan, you had armed militiamen, all white, show up at a government building and make demands of an elected official. If that's not the definition of terrorism, I don't know what is. You know? That's the thing. You went in with guns and made demands of an elected official. That's...
And if they've been black, they'd have called the SWAT team and everyone else and started shooting all of them. If they had been black. The only reason that they walked away without being riddled with bullets is because they were white men carrying guns.
Now, I want to go to Uncle Adrunius. He gave me two things. He said, what could the leaders of the countries have done differently to prevent the pandemic? But then he goes on to answer his own question. Nothing. There's nothing that could have been done to prevent the pandemic. I want to be clear. I don't look at the pandemic as whether or not someone could or could not have prevented it. It's, can we get to a new normal of how we deal with things in government or in society? Can we not have a government that says, okay, well, we're going to make sure we do this as bureaucratically as possible so that the states end up fighting the federal government, which is a function of how the president's dealing with things. But also, as a society, you know, can we come up with a new normal that says maybe, just maybe, we could be more cautious and say we don't have to, I don't know, rally against scientists saying please stay home by having rallies of hundreds of people saying we want to go outside.
Yeah, but before you even get to that question, you got to look at, you know, first of all, you know, if you fire an entire team that's made up to scout out and look for these things so that we can get early warnings. So it's not that you can't stop the pandemic, but of course, it's like you tell a child, hey, if you walk out in this on the street and you don't look both ways, you possibly gonna get hit by a car. But basically, what this administration done is put blinders on the child and told them to go across the street.
So I mean, I think that question has a lot of layers to it. For one, could the pandemic have been prevented? Sure, but I mean, according to independent news media, this isn't even what the mainstream media is saying is incorrect, because there's reports now coming out of China that they've had this since November. So I mean, if November was, for example, Dr. Ai Fen has been missing since early December, who's the doctor who whistleblowed on the first case of the coronavirus. She's been missing since then, and all of the interviews, well, I would say most of them that she's done have been pulled off by the CCP. So I mean, sure, the administration has its faults. That's certainly obvious. Italy had its faults, and Italy suffered the consequences. So I don't think we could pin everything, or simply the situation of what's going on in the United States simply on how the current administration reacted, because I mean, at its base, the states had the rights. The states acted accordingly how they felt they should respond. At no point did I hear that the administration said that you can't lock down, you can't do this. California, California. I'm in Minnesota. We have one of the lowest infection rates of the entire of the U.S. Iowa didn't lock down. I think it was Indiana. Wisconsin has a higher infection rate than we do, but yet they locked down before us. So it's not like they said there was a blanket order for everybody to lock down. Everybody still had their rights. Nobody was impeding on government rights. For example, Georgia's open. Georgia has a higher infection rate. Texas is open, but we're still closed. We actually had ours extended by 2 weeks. Now, the large consensus in the state of Minnesota is that people want to go back to work. We have a very large group of people that are going out of that are filing unemployment more now than during the onset of the pandemic. So my point is this: that we got to hold individual people accountable and not just lay this blanket blame. Because let's just say, even on a small level, we've been dealing with this with the information we've been given. Up to now, even the World Health Organization isn't allowed access to investigate the onset of the pandemic. So at what point do we say, okay, well, here's who's responsible, instead of throwing a blanket cover of...
Alternatively, I think you can look at this and say, do you care about protecting people and saving their lives, or do you care about making money?
But at what point do you, let's just say with the evidence that we have now, that the majority of people who receive
coronavirus, like this year, or are we talking about hundreds of years ago? Which Evidence? How much?
I'm speaking of now, because that's where my experience is with this right now. So, if we're talking about hundreds of years, then there's a larger pool for discussion. There's definitely some larger wrongdoings on the government on itself, but that's between both parties, both Republican and Democrat. So if we can agree on that, then that's fine. But as of right now, I would say there's a lot of things that need to be evaluated. I don't think the whole blanket. And I'm not an avid supporter. I'm not a Democrat. I'm more center right, but I would say that all the blame should not fall on the administration.
Well, I'm black. Okay, I'm sorry. I wanted you to finish your point before I go.
Go ahead.
All right. First off, I'm Black Panther left, but it's important to note.
Face like he's about to tear it to you.
First off, we can look at a confusion that people have between causation and correlation. One of the big things that we do know about Minnesota is that it's colder than everywhere else. So a lot of places that have colder environments, often people frequently aren't experiencing as much person-to-person contact, so social distancing is easier. That's not necessarily anything to do with what Minnesota has specifically done. It's partially due to circumstance. Another thing that we can really look at too, and when saying, is this a problem of the administration or not? One of the unfortunate benefits of this whole pandemic is that we can look at other countries and we can look at timelines. South Korea had their first case of a COVID positive person the exact same day as the United States. They, however, followed the ideas of scientists. They put on a very, very extensive surveillance campaign. They used tracing to find out what people had those certain contacts, and they set those up by using a system of somewhat social democracy to make sure that happened. We're having thousands of cases of deaths every single day. Right now in South Korea, I think as of yesterday, they had no new cases of COVID. We can say, what are the differences? Hop on.
I think Taylor also talked about earlier about what the pandemic teams that they had in place in the prior administrations that were disbanded. All of those plans that team had started with the base assumption that there would be testing, right? Like yes. every model that was built off of that team said there would be testing as a primary assumption, and that assumption was not met. So every possible solution to this pandemic, there wasn't one because that basic assumption wasn't met with the testing. So already we were behind the ball in that sense too. So I just wanted to add that as well.
Yeah, and we can look at also other diseases, right? We have had other coronavirus type viruses like H1N1, SARS, and MERS. Those were dangerous and infectious as well. We had lower amounts of cases because we had social safety nets, we had better surveillance team, and we listened to the recommendations of the CDC over the recommendations of government leaders. Look and compare the task force that did health and things like that during Obama's administration with H1N1 stuff, which were scientists, doctors, epidemiologists, compared to now, where we have people like the president's son-in-law on a board figuring out how to get masks. We have somebody from General Motors. We had the MyPillow guy, not at all a hyperbole or a joke. The guy that makes MyPillows came in and talked about COVID-19 responses and what they're doing for cotton masks and how they're going to distribute those. That's insanity. If you can't pin that on leadership, I don't know what can be pinned on leadership besides someone that has an abhorrent view of science and a very small appetite for scientific information. Kids running around with, should we take bleach? Should we look in sunlight? All of those kind of things make people very skeptical of following future guidelines by that group, and it's in a very strong representation of ineffectual leadership.
And the
Nothing
answer
shows that more.
the answer they came up with was to inject ourselves with disinfectant.
Oh well, I'll first thing you said about Minnesota, yeah, Minnesota is colder than the rest of the country, but at the very base, Minnesota is very communal. Minnesota, I would probably say, has the fewest snow days of any other state in the United States. Me saying this is, yeah, it's colder, but we still go to work and we're still very close together. We're just close together in public places, my job, malls, whatever. You can go to the Mall of America, the biggest mall in the United States, and you can go there and you'll still see people very hunched together. So not to say that that's not a thing. I mean, naturally, we may be social distancing as far as where we live, but as a community, we're very communal. There's not a lot of space when we talk about groups of people. And I would say that as far as the leadership, again, that comes down to the states. Chris Cuomo and the New York commissioner, health commissioner, was encouraging people to go to parades during the pandemic while people were locking down. I think this was early February, while there were recommendations for social distancing. They were recommending that people still go out and interact with each other. The metro was still running. So again, we have the federal government.
Whether it's a Democrat or Republican leadership, that's still a leadership problem. That's a leadership problem. So it's leadership.
Right. But you're saying the administrations. We have to be very clear because, you know.
It was an administration.
Well, exactly. But I know you're referring to Trump and this how they handled it, but again, there's still local and state personnel who didn't do what they needed to do to
piggyback off of every single other health crisis, every other hospital I've worked in. Every single time that we have large, big public issues, we have state and national-wide protocols. In my rural hospitals that I was traveling to, they were coming up through the local hospital infectious disease point person, as opposed to coming as national guidelines. When people do a whole bunch of different things, that screws up any way of doing modeling. It screws up good abilities to do tracing, and it's not how any system works. Just like the old analogy of like people are like, well, some states will do this and other states will do that and it'll be okay. That's like someone peeing in a part of the pool and being like, oh, only that part is the peeing section of the pool. That's not how disease works. Also, it's not how any state system works. State systems work by being supported by the federal government. And when Jared Kushner came on and said, those are our masks and they don't belong to the states, it's never worked like that, ever, that the federal government doesn't support.
So hold on, let me back up. We have here, Uncle Dooney said the U.S. government response to the coronavirus is the same as SARS, and SARS was not a pandemic. The only difference is the primary spokesperson is the president on this outbreak.
Hey, I
don't understand the question.
You ready to go? I appreciate being on your panel. I apologize about not finishing it. And thank you. The conversation has been stimulating and interesting.
Okay, give me 30 seconds. Let me tell everybody this. I gave everybody, if you didn't watch from the beginning, go back to the beginning. I left a link on the chat to his channel. Not only does he live in the Dominican Republic and have fun and blah, 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 but he raises funds for orphans. I've watched videos of him taking groceries. He's one of those people that didn't get a big organization. He does it himself with his friends. He does videos coming home talking about how tiring it is. Follow this guy's work. All right, now you can leave.
Blessings. Thank you for that. That's awesome, man.
Thank you, man. It's been a pleasure to meet you all. Thank you so much again, Yusef, for letting me honor you. Let me honor your platform. Thank you so much.
Later, brother.
Peace and blessing.
So let's look at some comments we have on the side real quick. I just want to go through.
I don't understand the Uncle Ladrimus one. I didn't understand that.
Let's see. What did he say? I'm going to go back. He said, where'd he go? He says, okay, the U.S. government response to the coronavirus is the same as SARS. SARS was not a pandemic. And the only difference is the primary spokesperson is the president of the outbreak. If you want to ask him for clarification,
Well, I just mean by definition, the question's wrong because SARS was a pandemic. A pandemic means that we have an outbreak of anything that crosses a number of continents and countries. SARS, by definition, is a pandemic. I don't understand. But I wasn't sure if it was a question or a point he was trying to make.
I guess we'll have to go in and clarify. Let's go to Nikkei speaks. Coronavirus is a fluke. Let's scroll down. Social distance is only hurting everyone, making the immune system weak. Staying inside won't save you. Shake my head. Bacteria doesn't jump 6 to 13 feet either. It's BS, and that is scientific facts.
I got a comment because I did read an article on Zero Hedge. Everybody has their news preferences, but studies say that coughs can jump up to 9 feet in the air, which if a sneeze can travel at 100 miles per hour, I don't see how it could be out of the realm possibility that coughs can't be projected. Whether that's 9 feet or not, we can debate that. But I definitely think that coughs, sneezes, or whatever are a good way for viruses and bacteria to get around, especially sneezes because there's so much force behind them. But I think the social distancing thing is good, but to rely on that till, day indefinite till somebody finds a cure or a vaccine or whatever you want to call it, I don't think that's very good. I don't think that's a good solution, in my opinion.
There's no other countries are opening up without vaccine. There is no vaccine for it. Other countries are opening up. They just use science. Also, just for the sake of it, and I'll let you go. Coronavirus is a virus, not a bacteria. The difference is important.
Aya?
I was just going to say, what is the solution if you feel that social distancing isn't a good solution?
I mean, at this point, I think since we know who the affected are, so we say, according to what the media says, that if
we don't know who they are.
No, because we don't have testing.
And they're asymptomatic. We don't know who those people are. They're asymptomatic. We don't have enough tests. That's the definition of not knowing who they are.
If you look at who the median age of who the affected are, it's people who are north of 44 years old, mainly between.
That's also not true either, right? The state
also wrong.
This is the data that I see that's on reputable sites, right? So this is what they say.
I'm talking about the science that's evolving as we speak, right? So you're talking about things that are rapidly changing because we're learning about them as they change. So even the estimates that you just gave, those things, they may be true, right? In terms of thinking about who's impacted, but we can also think that everyone is not going to fall in that umbrella, and there may be other aspects of vulnerability and risk that increase for other age groups, right? So thinking about strokes, blood clots, right? For people who are under the age of 40.
Right.
Yes, and actually people from the age of 20 to 40 years old are 40% of ER and ICU visits for this. So this just doesn't affect old people, and that's important to know.
Right, and we're talking about blood clots, right? We're not talking necessarily just about respiratory failure.
Yeah, we're also talking about pneumonia versus acute respiratory distress, and those manifest differently. We're also talking about the fact that it's a novel disease. We haven't seen it before. Right. That's the whole thing that they call the novel coronavirus. So these conjectures have been wrong, and that's why things keep getting worse. And we know how to stop this. Yeah, and we know how to stop this and cause less problems. Testing, tracing, having a unilateral form of system instead of a state built together in piece one, and we're doing none of those things.
Right.
We don't have enough testing.
Right.
Yeah.
As we learn the science of the virus, we need to go with what we know about the science of prevention and intervention. That's just facts.
Yeah, the first nurse to die from it was what was he, 40-something years old? He wasn't in that high-risk group. There have been children that have died from it, too. There's an 18-year-old, and California was the first to die that's under the age of 20. Those are not good things to make. Maybe it's a smaller group of people affected in different age ranges, but what if that person is your child or that person's your father? That changes stuff. We should be far more careful about that.
And what
We also
and what
have
I'm
more-
I'm
Thank
not,
you, Camille. Thank you. That was also a very good point.
Yep.
and so I'm not implying that this isn't this isn't true. I'm just going off what I read yesterday. So this isn't information that I'm just pulling out. This is from yesterday. So based on what I read yesterday, and we know this is what the median age group is at the moment. I think there's ways we should be able to manage the high risk people and still put ourselves in a position to where our whole economy doesn't shut down. I'm not saying put lives at risk simply because of the virus. I do think that more testing needs to be done. But again, how much damage are we willing to do sitting inside the house to where we get to the point where, the food infrastructure shuts down and now you have people that can't work and they can't eat. Then the
You're
virus.
asking the question in like the same way, but in a nice way.
Yeah.
How many people are willing to let die to save an economy?
Exactly.
Coming from a pro-life group, I find that such a fascinating hypocrisy.
Yeah.
Save unborn fetuses, but also, are you guys willing to die to make this money? Because that's what we're about right now.
Damn.
But people are dying at home, are they not? So whether you stay home or you going out, people are dying at home, are they not?
And a very hugely different amount of incidents. I'm sure there's something that's dying from an alligator attack at home, but it's less than being in a swamp. That's a poor one.
Okay, so my question is this then. So you recommend that everybody stays home. All right, so
I didn't say that either.
Well, the lockdowns, and we know what effect the lockdowns are having. So how are we going to mitigate the effects of the lockdown versus
I think if
social safety nets?
Yeah, and if people's basic needs aren't met, like there's things that are just not sustainable. You can't have both of these things happen at the same time.
So in that sense, and Uncle has a good point. Are we going to test 320 million people? And if that's the case, how long is it going to take? At some point, we need to do risk management. It's not how many people are going to let die. It's not the first plague or
we've tested 1% of people. We've tested 1% of people.
Okay, so are you saying that we test 10%? So are you going to say that we should stay locked down until 10% of the people and extrapolate data from that? Are you saying we test 15% of people and extrapolate data from that? At what point do you draw the line to say, well, all right, this amount of people can go back to helping rebuild the country? At what percentage are we stopping that thing? At what percentage do we say, okay, this is safe?
So to Uncle, I understand like maybe people's frustration with that. However, we have to realize a couple important things, is that other countries are opening up without a vaccine and without solid treatments for this. And they did it by doing lots and lots of testing. America is apparently the greatest country on earth, but we haven't found out a way to have more than 1% of people tested. And we haven't found out a way to have reliable tests, which is also an important thing. And instead of taking the CDC
and also doing systematic, shutdowns if needed, right? So if you find that there's an outbreak, you do a systematic shut. So if this is the path that we need to continue to take until we have other measures in place, which we do not have. So that's the expectation. That's what's happening. And what's actually quite funny is that we've had a playbook from other countries who were weeks
ahead.
We had
a playbook in this country, but we threw it out because Obama came up with it.
So
we had a playbook.
Right. So I sit here and just say, again, failings left and right.
Yes, and also something.
Camille said something interesting. She asked a question that I hadn't thought about. Now, me, as I tell people, I'm 42 and a half. I'll be 43 in July. I don't know how that math works. She said, will people who test positive be discriminated against? Look at HIV back in the day and what's happening to nurses now. I remember, I was a kid. I remember when HIV really hit the ground hard and seeing the levels of discrimination that people were getting who were even just suspected of being HIV positive. It was awful. It was genuinely awful. How are we going to deal with that? So let's say they do. Who gets access to that information? Is it going to still fall under the what is that thing that says your doctor can't talk about your medical stuff with anybody?
No. It's HIPAA.
HIPAA.
Yeah.
The Hippocratic Oath is like to do no
Oh,
harm.
yeah, HIPAA. Yeah,
But
yeah.
HIPAA is actually came up with by Clinton, and it was actually a response to the discrimination that people face with HIV. And
Right.
so there's a solid law against discriminating from people in their jobs and workforce due to that, which was, by the way, I like to bash on the right all the time, which is, by the way, exacerbated by a Republican president at the time during the HIV and AIDS epidemic, which totally caused the problem to be far worse.
So for those who may not know, HIPAA, Health Insurance Portability and Accountability Act, regulations are divided into several major standards: privacy, security, transaction code sets, unique identifiers, breach notifications, and omnibus final. I'm not familiar with the omnibus, but what I can tell you guys, for example, I worked with insurance for quite a while, and one of the strictest things that we had to deal with was making absolutely certain that the information that our clients gave us in their medical forms, their intakes about their health and the level of healthcare they've had or what they may be dealing with, those things had to come under lock and key, because they were going to take 2 pounds of flesh and your career if that information ever got out. Because that's, some of the most important information you have is your medical privacy. The question becomes, in the past, I remember people asking, should HIPAA be suspended if a doctor finds out that a school teacher has AIDS? Now, we found out that HIV and AIDS, you have to actually do a lot of hard work to catch AIDS from somebody. But the question
is, you can't catch AIDS from anyone. So I just want to clarify that.
Transmit?
Yeah. No. AIDS is a syndrome. It's acquired immunodeficiency syndrome, which is the result of HIV. It's not a virus, it's a syndrome. Also important to note that like SARS and ARD SARS is the disease, ARD is respiratory distress syndrome. So that's important to note too.
So, but here's the thing, it's very difficult to get it. Like, you really
I think what Camille's question brings up is that when we talk about diseases, we're not just talking about the disease itself, but we also are talking about how it takes on meaning within a society, which gives rise to things like stigma, stereotyping, discrimination, so on and so forth. So I think that this is a very relevant question, and it's important to bring up because we're not just talking about diseases. We're talking about the meaning that we place in a disease. And often that meaning is attached to things like power, resources, so on and so forth, perceived threat, right? Like, we're all social beings and we're all trying to make meaning of this situation in a very uncertain, precarious time. So I think that
also, also the people that are getting the disease too.
Say that again, Mo.
Also the groups of disenfranchised people that are getting the disease.
Mm-hmm.
Like, why didn't the government care about HIV? It's because it only affected gay guys, so they didn't care, and they didn't do a good job of being forward on it. Why wasn't sickle cell funded by the government until the Black Panthers did something about it? Because it only affected Black people, and no one cared. So the groups affected do sometimes change how serious something is. Mm-hmm. I just wish that America would have a disease that only affected dogs, then white people would care a lot.
That's a burn. But yeah, so I mean, this is all relevant. And even what we were talking about, some of the comments that I saw earlier about even people's beliefs about the coronavirus or any disease or any illness, right? Those all play a role in people's behaviors. So all of these things are important to think about and consider when we're talking about coronavirus and our approaches to it.
I want to put two things together. It didn't come with the package, but I want to read two things. One, Camila Richardson says, how will capitalism change? Will it have to blend with socialism to ensure people's basic needs are met? Okay, very reasonable question. And then we also have, where is it? Socialism is emerging. These are dangerous words. Not because capitalism or socialism is dangerous, it's because very few people outside of formal training actually know what those words mean. And this is where we get real sticky. I don't want to pretend to be smarter than I am. You know, have I read a few books? Absolutely. Have I read Capital by Karl Marx? Yeah. And for the record, if anybody wants a copy, let me know. I'll send you a copy. It's a really good book. But it's one of those things where the media, television, and particularly American politicians have done such an excellent job of making sure you don't actually know what it means, that the word is used to just scare people off. I mean,
and has been.
People go ahead.
And has been, right? Historically has been.
Yeah. That's the thing. You know, people just we hear the word and they panic and they say, no, you're gonna take away my Nintendo and give it to the poor kids down the road. And it's like, nah, that's not actually what it means. But most people don't know that. Hold on, let me give you guys a little something here.
And then even thinking about, as we were talking about earlier, economic approach and a government approach, right? Like of how we think about these different systems.
So if anybody wants a copy, let me know. Let me know. So that's the thing, you know. I say we may need.
I'll take a copy.
Cool. I got one coming for you. Got one coming for you. Yeah. Let's see. Until an effective treatment, and again, more good news here. Doesn't help minorities are affected more and turned away more for testing. So, because that's the other issue we got to remember. Even if you take away the concept of, well, what's going to change after dealing with the coronavirus? Well, here's the problem. Coronavirus isn't really the issue. The issue is, are we going to change the fact that there are huge numbers of people who don't get a chance to have good health care, who don't get checked, who don't live in an area where they can even have access to it? And it's an awkward situation.
But it's not an awkward situation. That's the design, no? Like,
yes, it's not an accident.
I don't ask questions. That was a rhetorical question, but you know, like, yeah, like this is a design. This is strategic.
So now what do we do?
I think that a social democratic systems set up that have solid safety nets allow people to have basic needs met, regardless if they have a job or not. I think that a lot of people, the 20 million Americans right now that have lost their jobs and also lost their health care, now very truly see, was it?
30,
wow. Have very much seen how bad it is to tie healthcare to your job. And I think it's just a bad idea to tie the idea that if someone's not productive, they don't deserve to live. It's just a horribly draconian way of looking at the world. And this is the result. Crazy amounts of death. And the thing about a lot of these deaths is, like, they can be, while not everyone's going to live from it, they are ways to make it preventable with good primary prevention, which everyone can't access. And when we have a lot of cities and places making lowest wage workers essential services, this is putting the most vulnerable people on the front lines and causing these problems and issues. Mm-hmm. Like bus drivers and things like that, which tend to be minorities, are now exposed the most often. Mm-hmm. And I hate that often in the history of this country, the canary in the coal mine is often Black and brown bodies, as well as disenfranchised populations. And then when it starts affecting middle Main Street, then it's a problem. Mm-hmm. I hate that.
Now watch this. What you said about needing to separate the concept of healthcare from whether or not you have a job, what would change if we didn't realize that we may be yanking the underpinnings of capitalism out from under it? Remember, I know people from my past career as a financial professional that financially could retire, but they had to have a job because no matter how much they had in retirement, which would have been enough to live off of, the reality is healthcare is so disproportionately expensive, they never would have been able to afford it on what they had. I'll even go farther, and I don't want to go too far down the expat rabbit hole. One of the reasons you see Americans do so well overseas is because once you're in a situation where you get healthcare just because you live in the country, and it's no longer attached to you having to work a job that you may not want to work or a job that you think you could do better if you started your own company, you'd be amazed at what people can do when they don't have to worry about whether they can afford medicine. You would be amazed at how many people can say, you know what, if I have to eat roasted chicken and a bottle of water because that's cheap for 2 years to set my business up, But if I get hit by a car, I get cancer, I'm still taken care of. I just can't afford anything nice while I'm building my company. That's a fair trade-off. You'd be amazed at how many expats that I do business with that cite that as a very reason.
Yeah.
I think it's also important to recognize too that people can make money in countries that have social democracies.
Right.
There are millionaires in like hardcore social democracy countries. People that make tons of money.
Yeah, it's full circle here. I think it brings us back to where we started.
Yeah, it brings us. So what's going to change? Because what is it? Nothing changes if nothing changes. We got a guest coming up. They're trying to come in the door right now. I'm just waiting for them to click a link. We've got another guest coming on. But yeah, that's the issue. Is nothing changes, and if we can figure that out, just the 4 or 5 of us sitting here in the evening, you can't tell me that it's not already a known. You know, what was it that they said in Game of Thrones? It is known. You can't tell us we're the first people smart enough to figure out that, hey, wait a minute, people wouldn't have to slave away for companies like fill in the blank, making not enough money. Because, by the way, there's a difference between having a living wage and minimum wage. Okay. What happens when people no longer have to worry about that? What happens when they have enough money to just say, you know what, I'm just going to grunt it out. I'll even go deeper. There was a link that I posted. I run a group called Black Expats in Brazil. And one of the links talked about the places in Sao Paulo that are the worst hit by the virus, because we were supposed to be out of quarantine let's say on the 10th. And they just said, no, that's not going to happen. That's just, no, it's going to be a while. And then they gave a list of all the places where the virus is doing the most damage. Lo and behold, you can literally overlay an income disparity map. The poor places are doing worse. And what we try to get people to understand, I always ask people, where do you think your wet nurse comes from? Because these are the people who live in the poor neighborhood, but these are the people who clean my house. These are the people who are cooking your hamburger when you go to that nice restaurant. If you don't pay attention to them, where do you think it's going to come from? You know, we talk about these poor neighborhoods and wanting to, well, maybe they're just dirtier than other people. No, they're not. They're just unclaimed. No one wants to take care of them. I want to see what happens when, for example, there's a lot that's talked about in Brazil about places called favelas. We don't have any in the United States. People say, is that the same as a housing project? It's not. It's one step below. We don't have anything like that in America. But that same guy who's a businessman who lives in an affluent neighborhood, probably white, who says, I don't really care about the favelas, he's starting to feel the pinch when that normal after payday bump of cocaine and a black hooker he goes to pick up down at the favela, that's gone now. Now he's starting to wonder, well, wait a minute, maybe I should do something about this. Now I'm being stereotypical and I'm using inflammatory words, but it's the truth. Let's see, hold on. We got another. Will drones take over the menial jobs in the internet and public safety effectively, putting more folks out of work? You can't stop technology. I don't know if that's going to be something in the corona world.
That's another segment for another time. I have thoughts on that, but I'm not going to. That's another segment for another time. Anyway, this was lovely. Thank you all. I have to run. I have to go.
Okay. Well, listen, I got some things to say that are inappropriate to talk about publicly, so I'll call you later. Okay, you going to be around?
I'll be around. Thank you.
Bye-bye.
Okay.
Are you going to come back?
Maybe.
Maybe. I got your baby right here. Bye.
Bye.
Huh. But yeah, that's the thing. You know, what is it? Here we go. When we talk about putting folks out of work, I think about this. Right now, if I call and order sushi to have for dinner, the guy delivering it is a guy who's on a scooter. He goes to the sushi restaurant, throws it in the giant backpack, brings it over. What happens when we finally do get those cars that are driverless? Because that guy's not making much money. I'll throw him a couple of bucks, and I'm sure he gets a couple of bucks per delivery, but it's not much. And now, here's where it gets real deep. With the business owners now have a pseudo-legitimate reason for saying, oh no, we want to fire all those people in the interest of public safety.
I mean, I'll say that I don't think that driverless, I think that the AI aspect, I don't think we're there yet. And not saying that we should kick the can down the road, but I don't think you're there yet. What I do agree with is, yeah, we do need to. I mean, the system's broken. I'm not gonna deny that. There's major issues that need to be fixed. But I mean, as far as that, the first aspect, as far as the public health thing, I almost want to say, like, you can't. There's certain aspects of just being a person working in a job that I don't think machines can duplicate. I work in like tech support, customer service, that nuance, working with people in general. And there definitely are nuances that exist that at this current state of time, I don't think that AI is going to be able to do that. And as menial as it may seem, as somebody being a driver or a cook or something like that, I just think that we aren't at that place. I do think that there's need to be more investment as far as, those people and making sure that they are at a lower risk, whether that's PPE, whether that's in looking into ways that they can protect those workers at a cost, that doesn't bankrupt them. I think that that's good. But, I'm saying, I think we shouldn't put the technology horse in front of what the current issue is as far as, people in this health crisis. That's just my, that's kind of how I see it.
I don't even know how to add to that because I agree. I just think that we're trying to parse out some things that can't be parsed out. I think that some of the things that we also need to talk about that are going to come up to change the world right now are those social interactions. Like in Brazil, you meet a woman, you hug her, and you give her a kiss on the cheek. If you're in Sao Paulo, if you're in Rio, it's both cheeks. People like to hug. People are social animals. How long do you think it'll be before we're comfortable hugging somebody again?
I'm going to say something inflammatory. That's not going to change in Rio. I'm sorry. That's not going to change. I have a lot of Brazilian friends on my WhatsApp, and I would say a good 80% of them aren't even respecting the quarantine, let alone just the quarantine. There's a girl I was talking to before I left, and they had a party at their house while quarantined. You know what I'm saying? So I think, yeah, you do have, and it may be something that's demographic, it may not be, but there's still a good portion of the society that's just like, to hell with it. If I get it, I get it. If I don't, I don't, So I really think as far as Rio, that's not going to change. I'm coming back in December. I can almost guarantee you I'm going to go there, and yeah, maybe people wear masks, but at the end of the day, that's not going to stop anyone from being physical with each other. Like I've seen people at the beach drinking beers right next to each other. WhatsApp it's almost like a microcosm for the rest of the country because people there's no filter, there's no discernment what's posted on WhatsApp. So you can automatically assume maybe
I would
that's
say
the
that
case.
I think that all the things that we talk about that are like social concepts can absolutely change. All it takes is enough people dying or enough people being affected by it before those things change. Like the whole idea of like Victorian like makeup that was super white was because of the Black Death. So we can see that like major cultural norms do shift depending on the severity of it. And the second thing too is that automation is absolutely going to mean a lot of people lose their jobs. I recently like found because I was like always pretty secure that a lot of different jobs are just too complicated for a machine. There's actually a really, really great AI app that actually summarizes research papers. And we're talking scholarly level research papers summarized down and hundreds of them. And that's pretty friggin' complex, and it does it faster than a person can. I don't think many jobs are as safe as we think from being automated. It's just going to be a part of the future that we're going to have to find ways to adapt to. I think that probably the future answer is going to be a guaranteed national income where everybody gets a certain amount of money just for being part of that country or the citizenry, because there's not going to be enough jobs, especially. Yeah, especially service industry.
I'll go even deeper. I always thought that my job as a writer, editor, those things would be like, who could take the place of a writer? When someone says, "What I need a specific set of resumes to go into the IT field," and I say, "Okay, let me answer you some questions, and I'm going to write out this beautiful resume that's going to get you this job." Or someone says, "What I've got a magazine, and I want you to ghostwrite. Give me 500 words on Brazilian acai eating." Cool. I found, one of my friends showed me something. Now, it's not good enough to hurt me yet, but I can smell the blood in the water. This AI will actually, you give it a subject, a couple of keywords, and it says, check back in a couple hours or we'll email you. How many words do you want it and how many paragraphs? And it will write a junior high school level paper.
There's AI that writes stock report reviews. Also, there's AI in our phones. Have you ever looked at the AI setting that if you start typing a word, if you keep on clicking on it, it'll finish a reasonable email? Like an email that's like maybe not as pointed as you want it to be. Yeah, it's already here, and it's going to replace a lot of people's jobs. It just is. I'm afraid of like the schism it's going to create that's bigger between the have and the have-nots, as people that are the large capitalists are able to use AI technology to and just their money and influence to really hurt those that don't have as much.
Well, I mean,
Corona to a dystopia. Do you have any better topics? What? It's getting dark, man.
Nicole, you look like you're in a witness protection program. Can you put the light in front of your face, not behind you?
Sorry.
It's those narco interviews where the voice is distorted.
Yeah, keep going. Yeah, because I'm like, wait, what?
I'm looking like a shadow. Yeah, I'm trying to turn around. The lighting is not very good in my room. So let's see. Am I better?
Do you still live in Morocco?
Pardon?
What?
Wait, sorry. Can you say that again?
What was that?
I didn't hear what you said.
Never mind. I'm just.
Oh.
I missed you, Nicole.
I know, it's been a while.
And while she's coming in, listen, everybody, make sure to like, comment, and subscribe. This is how I get to meet good people. I make sure you share this. We get to have a lot of great discussions, and we talk about three things. We talk about money a lot because that's my favorite subject, and cryptocurrency and savings and investment and credit. We also talk a lot about world travel, not just the countries we live in. And we talk about big social issues, and this is one of them. So let's do this. Oh, wait, damn it. What did I? Okay. Hold on. Get it. There we go. All right. So somebody got me echoing. You hear that?
To me.
So let's do this. I want, real quick, Alenda and Nicole, I want you to introduce yourself real quick. Don't be shy. I'm going to go pee while you're telling everybody who you are.
Alrighty. I guess I'll go first. So my name is Nicole. I'm from New Jersey in the US, but currently I'm in Taiwan. So it's Sunday morning for me. So hello from the future if you're in the West.
Hello. My name is Alenda. I'm originally from South Florida, lived in Brazil for about 2.5 years, and am currently back in the United States.
Cool.
I don't think we gave him long enough.
Yeah, it was very short.
How's Taiwan though? How's I heard things between like Taiwan and China are like fever pitch right now. So how's like the atmosphere?
I mean, yeah, there's a lot of tension, but I mean, everyday life here is pretty normal-ish.
Normal-ish, so nobody's like. Go ahead.
What do the two of you do? Are you students?
I'm a teacher here.
Oh, very cool. What do you teach?
I teach English.
Oh, okay. How about you?
Sorry?
Alinda?
Oh, hi. Non-practicing attorney specializing in anti-corruption, anti-bribery compliance. That's what I do. I work remotely, so I do that from kind of wherever I am. And the majority of my work is based in Brazil or Latin America, but I work from home, so it's wherever I am, that's where I'm working.
Nice.
Oh, that's awesome. So do you also teach online, Nicole?
I do sometimes, not as much.
Not as much now?
Well, I still work now. So here it's actually,
okay.
yeah. Here it's kind of normal, so I can still work.
Oh, so are they doing any social distancing or anything like that in Taiwan or no?
Not really. Because most of so here, I haven't been checking the news, but I think we've gone like 6 days of no cases. And most of the cases here were people coming from abroad. So a lot of people, most people stopped at the airport. So we've kind of been able to somewhat live normal.
That's awesome. So before the 6 days, what was it like?
It's still the same. So
no, I mean before things opened back up, or did things ever close down? So
right after Chinese New Year, they extended the break. They extended 2 more weeks of no more school for children, and some businesses also followed suit by also closing for 2 weeks. So that was kind of our lockdown. And then after that, they just put a lot of new rules in place for when you do leave the house.
What kind of rules are in place?
So, like public transportation, if you go into any stores, you go into school, you have to wear a mask. They check your temperature. You sanitize. They give you gloves to wear, and that's the main one. And if you've contacted someone who's been in a country that has a lot of cases, they'll also ask you to quarantine. So they're doing a really good job tracking people down. Yeah. So like,
go on.
So for example, not earlier this month, it's May now. So last month there was a really big holiday here. It's kind of like the equivalent of spring break in America. And usually this holiday, a lot of people will go to a lot of touristy places. They'll go to beach parties. And before that weekend started, the government was like saying like, oh, you guys should like practice social distancing. Don't go to the crowded places. Don't go to the beach parties. But what ended up happening is that a lot of people went to those parties. And after that weekend, the government was just like, we did all this good work and y'all blew it by going to a party. So the government made all those people quarantine. And then when I went back to work, we had to fill out a form stating that we didn't go to any of those places. So we had to tell them where we were that weekend. So they're really like tracking people down like they're the FBI.
Wow. Alinda, where are you?
I am in Southern California in the desert. The Imperial Sand Dunes is the area. It's federal land. Normally people come out here and ride their dune buggies and whatever, but the developed areas are closed. So unless you're willing to rough it out in the undeveloped areas, it's quiet for the most part.
Well, here's what by the way, for the record, for anybody who hasn't seen some of the conversations that I've had, Alinda is always a welcome. See, there we go. We did expat money with lawyers and how my mustache taught me girls. That was a good conversation we had. That's one of my favorites. But we were going over a couple of things before you guys joined, and one of them is, what do we do now? We know what's happened. We know what's happening. What are we going to look at tomorrow? For example, Nicole, where you are, and Linda, where you are, I'll give you an example. I saw the Orange County beach, I believe it was, that the government specifically said was closed the other day. And as soon as they said that, well, what did the people in the Orange County area do? They went and had a big party on the beach. They specifically said, wait a minute, are you telling us that this beach is closed? And the government said, yes, for health reasons, this beach is closed. And then they said, fuck all of you, we're going to go have a party. And I'm going to hold on, give you guys some receipts. Look at that. That's at Huntington Beach. This was yesterday. Look at that.
Wow.
Thousands of protesters flocked to Huntington Beach following the state and the state ordered OC beach closures. Just take a good look at that. Your fellow Americans.
That's funny. I mean, it's not, but it's kind of funny though. I don't know why.
So my question is, now that we are looking at how badly this is going, what happens after that? Are we looking at a situation where when the next time hits, do you think the government's going to come with a heavy hand? Do you think they're going to look up and say, you know what, you people can't handle this level of responsibility, so why don't I come in and handle you? Is that a possible?
I could see that happening. I mean, technically it happened where I am. So, for example, I think 2002, 2003, there was the SARS outbreak, which is also a type of coronavirus. So that was in Taiwan. And I remember when the coronavirus outbreak started, I was reading some articles, and it was talking about how after the SARS outbreak, what the Taiwanese government did, they kind of reevaluated the whole situation, kind of like what went right, what went wrong, and what they could do the next time something like this happens. And now with the current pandemic and seeing how Taiwan responded to things so quickly, I could see a lot of countries considering that for the next time, especially the places where it's gotten so bad.
Well, get this. I'm going to try and find a picture for you guys. Mila Richardson said Brazil was driving people off beaches with helicopters. That is absolutely true. Matter of fact, I'm going to show you a picture because this was amazing. This was just, there were some people who thought they were special and said, we're going to go to the beach out here in Brazil, even though we're not supposed to. So when law enforcement saw them, the helicopter pilot dipped in, turned his rotors, and gave them their own personal sandstorm.
That would have been interesting to see, but
yeah,
again, I don't know.
I mean,
from afar, though.
They are probably still pooping sand. And here's the thing, they made sure the video got leaked because it's one of those, no, you're not special. We do not want, here's what a lot of people in other countries are saying, we don't want to be Italy and America. Don't end up like that. See what the Americans did and how the Italians got ruined by it? Don't be them. And here's the other thing is, like, what are we going to do after this for protection? Because, for example, I don't have any children. Alinda, proud mom, children, generally speaking, are nasty. Going forward, what's going to change in their lives, besides dunking them, in a swimming pool after every encounter with other children?
I think a big thing to look at, too, is that the United States really hasn't had some of the similar tragedies as other countries. For instance, like, we look at big wars, there's almost been none besides, like, perhaps a civil war or there's a couple other ones, but like big wars that have been fought and that are like part of the collective consciousness of most Americans. And I think the individualistic societies like the United States often have like a failure to see the interconnectedness of different people. And so I hope that this is not it, but this may be like one of the first big things where it's like a national thing that touches so many people that it changes.
Belinda, did you hear what I asked you about how transgender children?
No, I didn't hear. What was the question?
What I said is that especially with children, how does this change things afterwards? Like, how does this make what's going on with your kids different?
Well, I have to tell you where my personal opinion is on the whole situation. I have a very healthy respect for nature and illness and disease. At the same time, I have a very strong, sense of responsibility for my own health and safety. I feel like in any environment, my safety is my responsibility. The safety of my children is my responsibility. And so, although we're receiving a lot of information about this virus and the level of, its pandemic level that it's reached, I also feel like people are in a position to make decisions for themselves. And so maybe that's why I wanted to hop on, because I said I want to give the U.S. perspective. One of my reasons for leaving Brazil when I did, I left it was the March 19th or 20th. I was in Brazil. My children were still in the United States, and I came back. And personally for me, I said, Brazil, it does have a history of military dictatorship. Their military and police do have a strong arm when necessary. And I didn't want to find myself in an environment where I felt like my freedoms or liberties or whatever might be oppressed and be separated from my children. So now that I'm back in the United States, I'm one of those people that's of the opinion that, yes, although this is a very serious disease and something that should be taken seriously, it's something that each person has an individual responsibility to take seriously for themselves. And so if people want to put themselves at risk, they should be able to do that. And for those who feel that they are at a higher risk, it is their responsibility to protect their well-being. And I know a lot of people disagree with that, but for example, the past 3 weeks I took my kids and hit the road. I was like, you know what, we need to get outside. We're not going to stay inside. I'm just not an indoors person. I like to be outside and in nature. And when things started closing, it created a panic in me. Like, where am I going to go? What am I going to do to be who I am and really for my sanity? So we've been sort of visiting the national forests and national parks here in the United States and camping and backwoods camping, whatever you want to call it, backcountry camping, and boondocking in the middle of nowhere. And this has been kind of enlightening for me. I've run into quite a few people that I probably wouldn't have normally crossed paths with. And what I have seen from the people that I've met is that there are two very different opinions here in the United States. Some people are very concerned about the virus and are really taking the stay-at-home order seriously. And there's a growing sort of faction of rebellion. There are people saying you are not going to take our rights for any illness, no matter what. And I mean, to see the we're not going to put race into this, but to see the division of people, it's very interesting. So for me, how I think things will change, I think here in the United States, it will be very different than it will be in other countries. Maybe it's because of our history in the United States and this idea that we're built on freedom and bravery and liberty and our pursuit of, happiness or whatever. But I think that things here in the United States will progress a little differently than they are in other parts of the world.
Well, let me.
And I think the children would be. Well, I think they'll be back in school in August.
well, you touched on something. I wanted to touch on. One, when you talk about individual safety, I totally agree with you. But I would also say, like the concept of the safety mechanism that when the children go back to school, one drop of pee means the pool has pee, not just the kid who peed in it. It's a situation where, yes, we all have a responsibility, But when you look at the way that it works with everything from vaccinations and herd immunity to, if we don't all self-isolate, that one kid that gets back into school with it can spread it to his teachers, his principal, even if the children bounce back with no problem. And we have two comments on the side I wanted to look into. Camille was talking about lockdown. She said, I think that will have to happen in the US as long as it's uniform. A dicey move during an election year, though, with Republicans pushing to restart the economy. And again, she wanted to be clear. She talked about lockdown. And Rudy, he said to Nick Speaks, he said, it seems people are rebelling worldwide with confinement, and they understand politicians and pharmaceutical are passing laws to restrict freedom and getting funding, as well as people are rebelling with confinement. Oh, no, he said the exact same thing twice there. So that's the issue, because we also have to combat that people are saying that this will last 2 more years. So now we're in this awkward situation where we understand the need for social distancing, but how much personal responsibility can anyone really get if we're not all doing it a little bit? If everybody did it a little bit, it would add up to a lot. But if you have everyone doing a lot of social distancing and a few people in key places that are not, it spoils the whole batch.
But that's what I've seen, and I was surprised to see that when I came back to the US, because when I left, I was in Guyana, and I mean, when they shut the city down, they shut the city down. It was like a ghost town. I'd never seen anything like that. And then when I got back to the United States, I went through immigration and customs, and nobody said anything. The stores, I mean, the what they call the non-essential stores are closed, but the supermarkets are open, Walmart's open, Target's open, people are in there. And so I felt like if we're not completely, if we're not really changing anything, I don't see how the current measures are really doing anything to curb the infection rate. Like people, you can't go to the beach, but you can go to Walmart. What's that?
You're saying Walmart and Target are open?
Oh yeah, they're open. They're full. They're full every day.
Target was awesome today. Target had enough cars for the back of the parking lot.
Yeah. Every time I talk to my parents at home, they always tell me they always try to go to the Walmart or any grocery store. They always try to go at 6 a.m, 7 a.m, because if they go too late, it'll be too many people there. So yeah, all the essential stuff is open. So I talked to my mom the other day. She said she went to Lowe's because she wanted to buy some seeds so she can start her garden.
Yeah. Lowe's, Home Depot. What I'm trying to think. There's so many. It's almost like business. Honestly, I was shocked to see so many cars on the road. I was like, "Where's everybody going?" I thought nobody was working. It's
social distancing
to me feels like only the fun things. The fun things are closed.
Yeah, it's like social distancing, but everyone's crowding at all the same places. Because I usually talk to my mom when she's driving to work, and I was just like, oh, because she's a nurse. So I was like, oh, you're probably going to get there a lot faster because there's no traffic. And she's like, no, it still takes me around the same time to get to the hospital. And I'm just like, how? Aren't people home?
False, because I work 20 miles from where I live, so it's easier for me to take public transportation. And you would think the buses should come earlier. I get there earlier, I have more time to, mess around, whatever. Nope. I still get there 10, 15 minutes before my shift starts. So I'm like, what the hell? Why is there so much traffic? And people are supposed to be at home. And the crazier thing is this, that today we did laundry, and the McDonald's had a line around the drive-in. I've never seen the McDonald's that packed. It's
more crowded than ever.
People have this money to spend, whether it's unemployment or the stimulus check, and they're just oh well, so might as well get out of the house, and they just crowd everywhere. Best Buy is even open, and it's these companies are making more money now than they were making pre-quarantine. I'm like, this shit is backwards.
Yeah.
Okay, hold on, real quick, pause. My mother said, who was 74, 75, she said the $1,200 check popped up in her bank account. She didn't ask for it. She said it just came. And I said, oh, okay. And she said, I'm not going to touch it. She said, I don't know what the government's going to ask for in return. I don't know when they're going to ask for it back. She said, I'm just going to let it sit there. She said, a lot of people in our family are like, oh, I got 1,200. Maybe I should do this. Maybe I should do that. She said, no, she's lived long enough to know instinctively to not trust the government. She said, they're not going to give you anything for free. Have they ever before? In her lifetime, when have they just handed you something and said, you know what? We just want to be nice.
That'll come out of next year's tax return.
Yeah. Whereas bonus points for Brazil, in Brazil, they actually are giving people. Now, you can argue if it's too much or too little. A lot of people say it's too little, but shout out bonus points to Brazil. If you're a business owner, if you're a single, let me rephrase that. If you're a small business owner, a single mom, things like that.
There's a stipulation with that though, because you have to be able to access that via the application to put it in. And if you can't do that, then you're SOL. Like I have a few friends that, because they haven't been paid for work, they've gotten the short end of the stick. So it's just like, well, sorry, because you can't leave your house to apply for this emergency stimulus, you're shit out of luck. So, it is a good move, but I think, I don't know, maybe it wasn't super practical, because maybe you have to think about whether those elderly Brazilians that maybe aren't tech savvy, you have older Brazilian people that live by themselves. I went to go see an apartment, and the guy had literally a TV from 1976 with the wires behind it and the twist knob. So it's like, how do you help these people navigate that to get it? But back to your point, it is a valiant, it's more admirable to just give people the money than to have some string tie behind it, next year's tax return. But some people don't depend on that. But then again, that's some people.
Well, let me back up for a second. We have Brother David Pitts, who's always going to bring the goods when he comes by. He has a fairly diverse palette of life experience. He's a polyglot, chess aficionado who travels the world and likes to bring different perspectives in. How you doing tonight, Dave? Where are you? And are you still wearing your overall bodysuit covered in latex to go outside and get the mail?
Well, no, I'm actually, I believe in the science, so I kind of follow what the latest trend in the science is. I still do take personal precautions, but I'd like to say that I'm not in the United States, I'm in Texas. One of the things that I've learned is that each state is on its own. Apparently that has been reinforced. Every state is on its own. It's United States of America. And so I've learned from this that the only thing I can do is deal with my local reality. My girlfriend, now fiance, is in Michigan, and her reality is totally different from mine, being that she's a nurse. So, and my reality in Texas is totally different from hers. So, yeah, my local reality is different from, let's say, someone from New York, someone from Sao Paulo, someone in South Korea. And it just got reinforced because every state is on its own. And where I'm at, every municipality is on its own. And it's a mess. So it's every man and woman for him or herself, which is right up YusefWateef's alley, because I think he preached that to me for years. And so to be cold and callous, I mean, this is horrible, but nobody gives a F here, and I guess I shouldn't. So that's the way it is. Let me explain something to you. Everything here as of Friday is normal, meaning that you can go into a restaurant and sit down and eat with some ridiculous, the tables are like 6 feet away and the waiter is standing. He's not standing by your table, but he's standing like in the distance. It's ridiculous. Every store is able to have customers. They can only have so many at a time. So people stand outside to go in the store, and as they come out, depending on what municipality you're in, there's another municipality 20 miles from me where everything is open. Gyms, nail shops, salons, movie theaters. And so, yeah, the numbers, there's thousands of cases a day. There's hundreds of people going to the hospital. The numbers are spiking beyond belief. But The people here have declared that, hey, let it run its course, and whoever dies, dies, and whoever lives, lives. So you might see me out in a mask and glove. I may have some days I may wear a gas mask. Someday I may go full hazmat. Someday I may wear a cloth mask. Someday I might wear charcoal, depends on how I feel that day. And I mean, it is what it is. I try to do the best I can to figure out how to survive a chaotic situation. And there's a new normal. I no longer shake hands. I'll give the Wakanda salute or touch my left breast or bow. I wear a mask out. I don't care. People say, well, a cloth mask doesn't work. Well, it makes me feel good. I wear gloves. I carry hand sanitizer with me. You're going to laugh. I take all kind of supplements. But I should have been taking this stuff anyway. And what I've been told is some rumor going around that, I don't know if this is true, maybe you guys can help me, but I've heard that this COVID-19 doesn't like Black people. That's what I've heard.
What?
And I've just heard rumors that somehow the COVID looks at that black skin and just attacks it beyond belief. So now I'm dealing with a racist virus. So I know that if my Black self ends up at that alt-right hospital with that alt-right doctor who sticks a ventilator down my mouth, I'm done. And that's what I'm trying to avoid. Turn it back to you, Sam. That's the rumor I heard. That's what I heard. I was looking at the news and they said there was a show called The Color of COVID. I was shocked. I thought I was in a dream. And I didn't realize that this is a racist virus. I've never heard of such a thing. Is that rumor? Help me.
Can I qualify that? Actually, almost any disease is racist when it's in a system that doesn't help minorities. Heart disease, all of those things, African Americans have higher mortality rates, not because of the disease or any specific thing about that, but our provision of healthcare in this country is very racist. That's actually the research topic of my dissertation. I study actually the effects of heart disease and how it affects African Americans. And it's because we don't have good social safety systems. We don't have good primary prevention. We have a fatalistic attitude on the part of African Americans, a distrust in the healthcare system that has not been good for us in the past, as well as physicians and other medical professionals that don't listen to symptoms that are brought to them by people of color, as well as women too. I think that any virus can be racist in the right setting, but it's not the virus, it's the people, not the problem.
So let me get this straight. So these comorbidities that African Americans have, like heart disease, diabetes, right? These comorbidities are there because the system is geared toward us not being able to have a social safety net in regards to these systems. So I was just having dinner with my 10-year-old son, and I was talking to him about food choices. And I said, son, you have blueberries and you have White Castle. You have a choice between eating some blueberries or getting some McDonald's. What choice do you have? We kind of do this exercise to try to get him to make the better food choice. So what can we do? And I'm going to leave you guys tell me. So what can we do besides a program, a CNN show, or Don Lemon crying about? What can we do to stop someone like me, from ending up in that hospital with high blood pressure so that Dr. Trump can stick a ventilator and some Lysol down my mouth?
That's actually exactly what my research does. One of the things that I focused on is finding ways to make primary prevention meet people where they are. So it was putting blood pressure machines inside of barbershops, a place that's like a community center or anywhere else where people feel okay to congregate and meet with others, as well as some place that people go regularly. Because my grandpa, he passed away in 2003 now. He still remembers the time when there was a Tuskegee experiment. He lived through that, the beginning and the end of it. Why would he trust a physician to go into an emergency medical place if he feels sick or ill when he has that kind of thing on in his past? So I think that we have to find ways in communities to bring the healthcare to us, because it's very unappetizing to have to go out and get it. The good thing about COVID, though, you're doing a good job of protecting yourself, trying to social distance and social isolate. Wearing masks, the surgical ones, it doesn't necessarily increase your chances a great deal of not getting it, but it does decrease the chances by about 50 to 60% of you passing it on to others. So I think that the PPE protection are always smart choices. If you do the glove thing, make sure that you think of a glove, it brings whatever you touch with it. So if you have a glove and you wear gloves when you go to the supermarket or whatever, bring them into your car with you is just passing everything that you touched from the supermarket into your car. So using it correctly is equally as important as wearing it. I try and tell everyone and anyone that listens about that kind of stuff how to use that stuff effectively.
Yeah. Wow.
Also, there's no okay.
Can I read something? Can I read something that we have in the comment section here? And I want to get some feedback on this. And it says, Camille said the issue and how social, economic, and health policy is managed. BW, I'm not sure. BW now in November will determine the outcome how health policy is managed between now and November will determine the outcome of the 2020 election in the United States. Then Rudy goes on to say, at Camille Richardson, do you expect to stay inside for 2 years and give up your freedom and let a politician and pharmaceutical getting more wealth with their new business model? She then replied, no, but a lot depends on how the disease progresses and how quickly treatments are developed. She also goes on to say coronavirus cases shot up today, the fastest 24-hour rate yet. Today in the U.S., as states reopened, people don't give an everything. Don't give an
No, it's all good.
Then Rudy goes on to say, I agree we need to be cautious, but be aware of the agenda. Plus, don't trust the mainstream media. They're a propaganda tool for the elite and the corporation. Protect your rights and your freedom. Nicole, were you keeping track of that on the side, or did you get a load of that?
Yeah, I heard.
Because that's one of the. Go ahead.
No, you can talk. You can finish.
No, go ahead.
So David was talking about food choices and like on how to make the right food choices. And yes, diet does play a role in some of the health problems that are pretty high in the African American community, but also where a lot of, well, not all, but like a good percentage of where people live is that they don't have the foods that would make their immune system more likely to not get any disease or sickness or to handle it better than normal. So I feel like when we talk about preventative health care, it's a system, but we also have to talk about the things that are in our environment. So it's kind of hard to always make the better food choice if it's not within your vicinity. And I remember a while ago, probably months ago, I was watching this video about this woman. This Black woman, she lives in LA, and she kind of started her own grocery shopping business where she would bring fresh produce from some farm in the area in California and bring it to those communities that are more likely to that are in food deserts, so people can have that access to fresh produce and maybe less processed meat and other food items. So I feel like that's also something that should be brought into the conversation when we talk about preventative health measures.
Do you think in the future, when we talk about how the world's going to be different after Corona, when we look at the things that, and I want to make sure I'm not speaking outside of my purview, that the people who are most affected by Corona are the same people who are most affected by any disease, sickness, or virus, meaning if you are overweight, if you are diabetic, if you have been making poor food decisions, it's going to kill you faster. It doesn't necessarily mean Corona. Do you think people would say, because here's my theory, I don't know when I'm going to die, but I want the Grim Reaper to probably run out of breath while he's chasing me down. I'm not giving up anything for free. I want to try to eat better, lift weight, do all those things that I can to just give them that push away to say, look, there's probably somebody easier out there. Do you think anybody's going to wake up and say, listen, I had a fat uncle that died, maybe if I'm just not fat. Like I know a guy who his uncle died. He was 40 years old. He died of COVID. Like they 100% said it was proven COVID. But of course, he was an overweight taxi driver who lived out of a fast food window.
Mm-hmm.
Do you think anybody in his family do you think that he could be that poster boy for, I don't want to be overweight and sickly and diabetic and high blood pressure on top of? I worry because I have two friends who just, I don't know if the right word is come out, but on Facebook, they both came out, two separate timelines, two different people, as diabetic. And when I say diabetic, I mean an A1C level of 6.5. Mo, can you give us a quick A1C right now?
Yeah, A1C is based on like a hemoglobin level. When we look at a blood glucose, like the point finger stick test, that's generally like a snapshot of a one time. Hemoglobin A1C gives you a variable kind of number that helps you estimate what your blood sugar has been over a certain period of time. 6.1 is definitely what we consider diabetic. And then each of those numbers and points on the scale correlate to a specific blood sugar amount.
Now, here's the thing. Oh, by the way, John Nothing said it's inhumane for community not to have access to a produce market. I agree. But here's where it gets ugly. Both of them talked about now I'm battling diabetes, and I got to tell you, I didn't broach this conversation with them because I'm afraid, and I don't want to. I don't know how to handle this. How do I handle looking at these people I care about people and thinking, my goodness, you're grossly overweight and diabetic now. And I say now because the reason, and I'm getting judgmental, they weren't always this way, but now you've got to worry about getting sick on top of that. And how am I going to deal with that?
Mm-hmm.
I don't know if you can. There's so many factors. Weight and metabolism is not simple. It's just, I'm sure it's a lot of social history behind that. It's a lot of environmental history behind that. I'm sure it's really complicated. If not, everybody would be losing weight overnight in seconds. So it's not easy. Like, I know that my diet, so I'm going to use me for an example, and that way we won't leave out the guessing game. I went from a all vegan lifestyle to a typical sad American diet from going from my first marriage to my second marriage. And that's because my second marriage, my ex-wife had poor food choices, and I ended up eating like that. And I ended up going from no pills to now lisinopril. That rhymed, didn't it? No pill to lisinopril. And it's a high blood pressure medication.
It's so an ACE inhibitor.
I'm trying to reverse that. So I'm someone who, and I don't live in a fancy neighborhood. Not now. I did live in a fancy neighborhood. I lived in a fancy neighborhood with the ridiculous produce section and the super Kroger with the person going, "Hi, sir, may I help you cut up your salmon today?" I lived in that kind of neighborhood with the white picket fence and people singing classical music on the corner, and I drove right over to McDonald's and got me a double Big Mac and shake. And that is because I take total responsibility for being too lazy to go and get me a piece of fruit from the supermarket. So the great thing that COVID-19 has done for me, it has completely taken me out of the eating out. Now I have no desire to do it. I made a power salad today. I can make my own dishes from scratch, and I'm photoshopping it and taking pictures with Instagram with other foodies and making ridiculous great meals from scratch. And so I realize it, but now I know that I can go from no pill to some lisinopril back to no pill if I tighten up that diet. And this disease has made me realize, because remember, I'm dating someone who is coming home with horror stories every day. Oh my God, I saw 5 die today. I had to intubate 6. This is horrible. And they all look like us. So I am definitely afraid of going to Dr. Huckleberry Finn's emergency room. And that has literally scared me into eating better. Can fear make people make better food choices? I'm not sure if that's going to help them live better, but this has made me, I'm using myself, this has made me, I'm someone who went from good food choices to bad food choices because I was just too lazy. Because you know what? There's something they put in those McDonald's fries that are addicting. I just eat them and, oh my God. I'm a Starbucks junkie. I literally went to Starbucks every day and got the same soy drink, knowing I shouldn't be drinking soy every day. I got the same soy drink and it was like crack. I got it every day and spent hundreds of, now I haven't been in 30 to 40 days. So this disease has literally scared me and my black behind into not, I hope that doesn't offend anybody, into not ending up in that emergency room. Because like the gentleman said, I feel guilty because I have all black doctors, I know that's racist. I apologize.
No, but actually, to be honest, that's smart. You'll probably live longer. Just being honest.
I don't want to go to the hospital. I don't trust those folks. So I know that we have bad supermarkets and markets. But in Detroit, where I recently came from Detroit back to Texas, this is a city that is 9,000% black on the ground. I don't care. The stats say 78%. But when you live in Detroit, you see no white people. There's one Whole Foods downtowns, and then the rest of them are these crappy supermarkets. And the choices are poor. You have to go to the suburbs or you have to go to Whole Foods downtown. And Whole Foods downtown is expensive. But you know what? I take my behind down to that Whole Foods downtown because I have to. I have no other choice. If not, I'm going to end up at Sinai Grace or Henry Ford Hospital or St. Joe's. And them same doctors that was up there holding those firearms up in Michigan talking about open up the governorship is going to be operating on me. And that's what keeps me paying $15 for 3 pieces of fruit at Whole Foods. I mean, we have no choice. It has to be a radical change, maybe growing out the garden, food co-ops. And again, along with political pressure, because right now it's the house is burning. And yes, policy changes, blah, blah, blah. But right now, what's the stopgap solution?
Yeah. I feel like
go ahead.
Oh, no. Yeah, I was just going to add, I feel like in general, like health education is just one big like elephant in the room that most Americans just choose to ignore. And the other situation has started to wake some people up, but still has a ways to go for sure. And I wonder post-COVID if this would make some people reconsider, especially knowing like how many people who've died from the virus who've already had a lot of pre-existing conditions that could have not existed if they were to eat better, especially those who had the access to eat better.
Wow.
Well, I don't know. I just say I don't know if there's going to be necessarily a huge post-COVID like many people think. COVID and coronaviruses are pretty resilient, and they'll probably always be with us for quite a long time. And there'll probably always be at least somewhere in the background. So there's going to be have to make a lot of long-term changes. One of the things too that I think is important to look at is why so many people that are African Americans or other minorities get affected by it is that infectious diseases are always going to be higher in people that like live in tightly grouped areas, and that's like not having space is part of like not having a lot of money due to systemic racism. And so we can expect, unfortunately, that in metropolitan areas we're going to see a huge spread of it, and it's unfortunate, but that's what it is. But I was going to say eating healthy is always a great choice no matter what, and that always is going to help you if you can make good food choices. I have to head out, but it was great being a part of this as always.
Well, hold on.
Are we going to say something?
Can I ask one quick question before you go?
Sure.
And this is a selfish question, by the way, about good food choices, because I don't want to fool myself. And we can always trick ourselves into thinking we're making better decisions than we actually are. Look at this. I will go to any of the coffee places back when I was in the United States, or to some extent outside the United States, and I would get a coffee, and if I wanted to treat myself, I would get a sugar-free flavoring, like a sugar-free caramel inside.
Uh-oh.
Does it make a difference?
Mm-hmm. In certain ways, yes. Anything that's sugar-free, all the different types of things that are like diet or sugar, they're generally indigestible carbohydrates, kind of like celery. So you can't get the calories from it, but you can get the sensation of sweetness. The problem with is that it does kind of like train your mouth often and your taste buds to like sweeter things in general. And so I think that's a negative part of it. I think it's better to just stop liking and stop eating so many sweet things so that you don't have to have a solid substitute for that. Another thing is, too, is that like fruit and all those other things are equally as sweet and they're good choices. And also, just American foods in general, or processed foods, just have a lot more sugar in them. There's like sugar in ketchup and everything else. It's why McDonald's is partially addictive. Sugar is a very addictive substance. Tastes good. It's that food.
Well, listen.
All right.
If you got to take off, I think that's a good time for us to say goodbye. Nicole, you and I want to have a one-on-one with you because you've written some things that I really want to dig into. You've written some great things. Dave, I'm going to give you a call later. Gonway, hurry up and get back to Brazil. I want to leave everybody with one more thing. There's something that I did that I want to share with everybody. I wrote something called Free Help for Stress. And when I say wrote, I didn't write it. What I did is I created a list of as many phone numbers as I could and email addresses as I could of people to talk to. We live in a stressful time. We live in a time where a lot of us just need somebody to talk to. Okay? And I put this together, and I also put it in the comments. My formatting is really bad, okay? But this is what I did. I wrote free help because right now everybody I know needs counseling and therapy, so just call a free number. It ranges from depression, suicide, LGBT, to just being sad. There is help for you no matter what. I wrote that because I can tell I was late because that formatting is just awful. And you can either pause here, or there is a link in the comment section to where I put it on my Patreon site. This has everything from the National Sexual Assault Hotline to AIDS, to suicide, to cocaine, to child abuse, to crisis. All these phone numbers, again, it's in the comment section under a red dot. You can click it. I actually put it there as a PDF as well so that you can find the number relevant to you and just call them. You don't have to tell me you did it. You don't have to put anything in the comments. But if you're at that point where you need somebody to talk to, you know, say, hey, you know what? I'm feeling stressed out. Family, I'm just going to talk.
It's a solid list.
Yeah.
Wow, that's a comprehensive list.
Awesome.
So
that is a comprehensive list, man. Wow. Has anyone here been personally touched by COVID? I mean, I have. I've had a direct relative end up in the hospital. Anybody else on here?
Yes.
I have some friends who've had it. Some people I went to school with.
Yeah.
I got some relatives pass away.
Friends who have relatives with it.
Oh, sorry, man. Yeah, this is I don't know. This is like this is life-changing in the sense that I feel like it's funny. I feel like the theory of being in the Matrix has gone to the reality of being in the Matrix. You know, because I remember I would sit around and laugh at the coffee shop, at the Starbucks, and we would talk about everything from the Bilderbergers to the, you know, flat Earth versus round Earth theory, just running our mouths. And then when this stuff really SHTFs, you really realize how unprepared you are. I'm really embarrassed how unprepared I am. Like, you know, I just was unprepared, and this has woken me up in terms of being so not attached to getting caught up into the daily runaround of local stuff, and think about the big picture. And the big picture is life and family and loved ones, and that's the bottom line. And as long as I'm alive and breathing, my social norms have changed in the sense that I'm going to be a little bit more prepared. I didn't say I was going full prepper, but I might go quarter prep, and just be more prepared in my finances, my diet choices, my ability to have more resources at my local, resources available to me locally without having to depend or call someone. You all don't realize how many calls I've gotten from friends like, hey man, I don't know how to fix a toilet. Hey man, I don't know how to fix a leak. Hey man, I don't know how to cook. I don't even know how to cook a meal. Can you show me how to put a steak on the grill? I've gotten that call. Like, I don't know what to do. My child has a cut and I don't know how to clean it. Something minor. My car has, it needs a brake job and the brake place is closed. Can I do it? I've gotten those kind of calls, and luckily I've been able to help people. But the new norm for me is just being more self-resourceful, self-reliant. I can't do everything myself, but in terms of self-reliance and having the ability to do some things like having a garden in the back, that's changed for me, having more preparedness, because, I was embarrassingly one of those people lined up at the supermarket trying to get some groceries. And that was an awful feeling. And I never want to do that again. I never want to go through that again. I don't know if that's preventative, but I don't want to be one of those people in line looking at the shelf talking about, wow, what am I going to do for the next 3 weeks?
Well, hey, this is Wateef, your best friend prepper, telling everybody, don't wait. All right, everybody.
I agree with it too. Yeah.
Everybody
has been a good, solid idea. Make sure you're taking care of yourselves, I guess.
Yeah, for sure.
Thanks, everybody. You guys can hang around. I got to say goodbye to the crowd, and everybody make sure you click, like, subscribe, and all that good stuff. And please be safe.